Ever thought about how common male pattern hair loss really is? Let's peel back the layers on this topic. Male pattern hair loss, medically known as androgenetic alopecia, is a universal phenomenon. It's a global issue that affects a staggering number of men, crossing all boundaries of geography, race, and culture. It's an interesting fact that male pattern hair loss can occur at any age. That's right, it's not just an older man's issue. However, the frequency does increase with age. It's estimated that by the time they reach the age of 50, nearly half of all men will have experienced some degree of hair loss. And it doesn't stop there. The numbers continue to climb with age, reaching even greater proportions in the later years. So if you're experiencing hair loss, know that you're not alone. It's a common issue, and we're here to explore one of the solutions. Enter oral minoxidil, a potential game changer in the fight against hair loss. As we delve into this intriguing solution, let's start at the beginning. What exactly is oral minoxidil? Originally, minoxidil was not intended for the purpose of hair growth at all. In fact, it was first developed in the late 1950s as a treatment for high blood pressure, known in medical parlance as hypertension. However, during its clinical trials, an interesting side effect was observed. Patients started sprouting new hair. This unexpected discovery paved the way for a new application of minoxidil, one that could potentially benefit millions around the globe. Now, when you hear the term minoxidil, what probably comes to mind is the topical solution that's applied directly to the scalp. This is indeed the most common form of minoxidil, and it's been widely used for decades to help slow or stop hair loss and promote hair regrowth. But this is not the end of the story. The topical solution, while effective for many, does have its limitations. Some people find it inconvenient to apply or experience scalp irritation. Others may not see the results they're hoping for. It's in response to these challenges that oral minoxidil enters the scene. Oral minoxidil is simply a tablet that you take by mouth, making it a potentially more convenient alternative to the topical solution. It works systemically, meaning it affects your whole body, not just the scalp. This could potentially mean more powerful and widespread effects on hair growth. However, it's important to note that because it works systemically, oral minoxidil may also have more side effects than its topical counterpart. These can include changes in blood pressure, increased heart rate, and fluid retention, among others. As always, it's crucial to consult with a healthcare professional before starting any new treatment. Oral minoxidil, therefore, presents an intriguing option for tackling hair loss. It's a testament to the ongoing quest for solutions in the face of this widespread issue. As we continue to explore and understand its potential, oral minoxidil could indeed prove to be a game changer. Now you might be wondering, how does oral minoxidil work to combat hair loss? Well, let's dive into the science behind it. Oral minoxidil is known as a vasodilator. If you're thinking that sounds like something out of a science fiction novel, don't worry, it's not as complicated as it sounds. A vasodilator is simply a substance that widens or dilates your blood vessels. In other words, it helps to increase the flow of blood in your body. So why is this important for hair growth? Well, your hair follicles, which are the tiny structures in your skin that produce hair, need a steady supply of blood to function properly. This is because blood carries vital nutrients and oxygen to your follicles, which are essential for healthy hair growth. When you take oral minoxidil, it works its magic by widening the blood vessels in your scalp. This increased blood flow means that more nutrients and oxygen can reach your hair follicles. In turn, this creates an ideal environment for your follicles to produce healthy, strong hair. Now, you might be thinking, well, that sounds great, but how exactly does widening my blood vessels lead to more hair growth? The answer lies in the hair growth cycle. Every hair on your head is at a different stage of this cycle, which includes a growth phase, a rest phase, and a shedding phase. By improving blood flow to your follicles, oral minoxidil can help prolong the growth phase of this cycle. The result? Your hairs have more time to grow before they eventually shed, leading to fuller, thicker hair. It's also worth noting that oral minoxidil doesn't just help with hair growth, it can also slow down hair loss. By ensuring your hair follicles have all the nutrients they need, it can help prevent them from shrinking and becoming less productive over time, a common cause of hair loss. So, in essence, oral minoxidil gives your hair a better environment to grow by improving the blood flow. And who wouldn't want to give their hair the best possible chance to flourish? Having understood how oral minoxidil works, let's delve into some key points about this medication. First and foremost, oral minoxidil is lauded for its effectiveness. It's a vasodilator, which means it widens blood vessels. This action increases the flow of oxygen, blood, and nutrients to your hair follicles, promoting hair growth. Numerous studies have shown that oral minoxidil can significantly slow down hair loss and even stimulate new growth in some cases. However, it's important to remember that it's not an overnight miracle. Like most treatments, it takes time to see results. Generally, you might start noticing changes within 3 to 6 months of consistent use. Some people might see changes earlier, while others might take a bit longer. Patience is indeed a virtue when it comes to oral minoxidil. Next, let's talk about side effects. While oral minoxidil can be a game changer for some, it's not without its potential downsides. Common side effects include increased heart rate, swelling in the lower limbs, or unwanted facial hair growth. Less common but more serious side effects can include dizziness, chest pain, or rapid weight gain. It's crucial to be aware of these possibilities before starting the medication. It's also worth noting that oral minoxidil is not suitable for everyone. Certain medical conditions like heart, kidney, or liver disease might make it unsafe for some people to use. Moreover, it's not recommended for pregnant or breastfeeding women. Therefore, it's absolutely essential to consult with a healthcare provider before starting the treatment. They can assess your overall health and medical history to determine if oral minoxidil is a safe and suitable option for you. In addition to these points, it's also worth mentioning that oral minoxidil is typically used as part of a broader hair loss treatment plan. It's often combined with other treatments like topical minoxidil, finasteride, or hair transplant surgery for more comprehensive and effective results. Furthermore, it's important to realize that oral minoxidil is not a cure for male pattern hair loss. It can help manage the symptoms and slow down the progression, but it won't eliminate the underlying genetic factors causing the issue. If you stop taking the medication, your hair loss is likely to resume. Lastly, the cost might be a consideration for some. Oral minoxidil is typically more expensive than its topical counterpart and may not be covered by all insurance plans. It's worth discussing this with your healthcare provider or pharmacist to understand the potential financial implications. These points underscore the fact that while oral minoxidil can be effective, it's not a decision to be taken lightly. So, we've covered quite a bit about oral minoxidil and its role in combating male pattern hair loss. It's time now to wrap up our discussion and recap the key points we've explored today. Let's begin with the understanding that male pattern hair loss is a common condition. It's something that affects many men around the world, and it's nothing to be ashamed of. In fact, it's a part of life for many of us, and it's something that we can approach with understanding and the right information. Then we moved on to introduce oral minoxidil. It's a medication that was initially used to treat high blood pressure, but was discovered to have a rather intriguing side effect. It can stimulate hair growth, and it's now being used as a treatment option for male pattern hair loss. We delved into how oral minoxidil works to combat hair loss. It dilates the blood vessels, allowing more oxygen, blood, and nutrients to reach the hair follicles. This leads to the stimulation of hair growth and can help to slow or even reverse the process of hair thinning and loss. We then highlighted some key points about oral minoxidil. It's not a magic pill that will instantly give you a full head of hair. It takes time to work and it requires consistent use. Side effects can occur, such as an increase in body hair, changes in heartbeat, or swelling in the extremities. It's essential to be aware of these potential side effects and to discuss them with a healthcare provider. And finally, we've emphasized the importance of consulting with a healthcare provider before starting any treatment for hair loss. They can provide you with the right information, guidance, and monitoring to ensure that the treatment is safe and effective for you. Remember, if you're considering oral minoxidil or any other treatment for hair loss, always consult with a healthcare provider first. It's about taking control of your health and making informed decisions. Here's to embracing our journeys, with or without a full head of hair.